You're probably here right now because you or a loved one is suffering from a chronic, debilitating syndrome called fibromyalgia. Or you're here because you're suffering from chronic pain and you're trying to find a primary healthcare professional who understands fibromyalgia and has had wonderful, maybe even incredible success in treating patients with fibromyalgia. I want to let you know, in our clinic, we are those doctors. We have had phenomenal success treating those patients with fibromyalgia using brain-based therapy, and that's what we'll be talking about today. Now, I do want you to understand that this is going to be a brief video, even though this is a very complex subject. So if you want more information and more detail, click Contact Us on our website or call us at 482-0723. We will consult with you. Today, what we want to discuss are two major facts about fibromyalgia. Number one is that fibromyalgia is not a muscle problem. And let me repeat that. Fibromyalgia is not a muscle problem. I know that probably confused you because it confused a lot of people, because patients will come here and tell me, Dr. Veselak, I know my neck is hurting and it's a muscle problem, and my shoulder muscles hurt, my back hurts, and my hip muscles are hurting. The muscles that are hurting are nothing more than a symptom of another underlying cause, and that's what we're going to talk about today. Think of it from this standpoint. You've probably had fibromyalgia or chronic pain for years, maybe even a decade, and you've been to a laundry list of medications, and what have all those meds done? They treated your muscle pain. So if you're treating your muscle pain, it would have fixed your problem by now. You wouldn't have fibromyalgia. So there has to be another underlying cause. And that leads to me to my second point, and that's, what is the latest scientific research says about fibromyalgia and chronic pain? And that is, fibromyalgia is neurogenic. Now what this means is that it's brain pain. It means the pain is generated in your brain. Now some of this gets a little complicated, but let me try to explain what is happening. What I want you to know is that a part of our brain called the cerebellum, which controls movement, starts our movement and starts our thought process. The cerebellum always fires to the brain, and the brain fires to the lower brainstem. The lower brainstem then fires to the upper brainstem. It is generally the upper brainstem. This is all or nearly all of our problem when talking about fibromyalgia and chronic pain. If you think of the upper brainstem as a juvenile delinquent, and the parents, which are the cerebellum, and the brain, if they are functioning properly, our juvenile delinquent is going to act somewhat responsibly. But if we have our cerebellum, our brain, that's decreasing its function, we're going to have our brainstem that's not functioning properly. How do we know this? Well, our brainstem, for example, controls our sleep cycle. Like, for example, patients who have chronic pain and fibromyalgia have a very difficult time getting to sleep and even staying asleep and getting into a deep sleep. Also, this upper brainstem controls the diameter of our pupils. A lot of time, patients with chronic pain and fibromyalgia walk outside and the sun is just almost kills them, or they walk into a bright room and it only affects them and nobody else. We have to put our sunglasses on right away when we walk outside. Also, with fibromyalgia patients, with every patient, every human being, we have our right brain and we have our left brain. Now what happens with fibromyalgia patients is that we have a left brain that's decreased in its frequency of firing. How do we know this? Well, the brain has compartmentalized. That means there's certain things that's supposed to be in your left brain and certain things that's supposed to be in your right brain. Like, for example, your right brain is your negative brain, your sad brain, your gloom and doom brain, if you will. So our left brain is our happy brain. So your left brain kind of has that happy, smiley face to it. So if you lose your happy left brain, you're going to increase the frequency of firing. And you're going to be more of a negative person. You're going to be sad and kind of gloom and doom all the time. Also, in our left brain, I'm going to have to throw out a bunch of big words that I will explain in just a second. The area in our brain that's called Wernicke's area, and Wernicke's area is area number 44. There are some neurologists that had to put his name on some sites and give it a number. So Wernicke is the area of our brain that allows us to hear and understand what someone's telling us. Well, here's the problem. When a person has fibromyalgia, we usually have to tell them multiple times before they can actually comprehend and understand what we're trying to ask them to do or what message we're trying to convey to them. There's also an area in the front part of our brain that's called Broca's areas 22. Well, what does that mean? That means in order for me to actually carry on oral communication and talk to you, that area of your brain has to function properly. Now there's that little highway that goes from Wernicke's area to Broca's areas that's called the arcuate fasciculus. Now I'm going to try to make sure that's all the big words we're going to use. The arcuate fasciculus, if you think of it like a highway, if we get some problems on the highway going to LA and we decrease the transmissions of our cars, our traffic going to LA, because of block, there's going to be a problem. What happens is that when our left brain decreases in the frequency of firing, Wernicke's area and Broca's area decreases its function, and what happens is they just don't communicate back and forth. So a person starts to say a sentence and then they're like, what was I about to say? And they can't even literally finish a sentence structure. Or somebody walks in a room and they're like, what was it that I came in here to get? Why am I here? So we have confusion. We have problems trying to find words, and those are all left brain functions. So how will I help somebody using brain-based therapy with fibromyalgia? Well, I've been treating fibromyalgia patients for over 20 years and have studied hundreds of hours of postgraduate training on this subject in chronic pain. We evaluate people neurologically and metabolically, and then we give them appropriate recommendations based on our findings. We treat the patient, not the diagnosis. We ask that you bring in your blood work to help us analyze your specific cause of the problem. As well, we do a thorough neurological evaluation. I know what you're probably saying is, here Dr. Veselak, here's my blood work, it's already been done and everything's normal. Well, if everything is normal, then why do you have chronic pain? Why do you have fibromyalgia? Please remember this. There's a lot of normal sick people in the world, and we're not looking for normal, we're looking for optimal. We're looking to see if your body and your brain are functioning at its optimal level. So there we have it. As a recap, your fibromyalgia is not a muscle problem, it's a symptom of a neurogenic condition, which means it's actually brain pain. I've gone over how we're going to correct this problem using brain-based therapy. Please read the information and call our office and find out when our next free seminar in our clinic is. I'm Dr. Michael Veselak, and thank you so much for listening.